All right. Good morning. Good morning. Good morning. I'm Raymond Falabomo. I'm at Wings for Life International today. I serve as the country director for Wings, and the good thing is today is the 12th Friday, and I just celebrated my birthday on Sunday. Yeah, I'm so impressed that I'm able to live and see these wonderful things happening around me. That's amazing, you know. With all of the people I got around me, very supportive. I'm so much impressed. That's a good thing. But anyway, folks, today is May 12th, 2023. And I'm here today to discuss a topic that is very, very relevant. That is ACEs. We're going to be talking about ACEs, which is adverse childhood experiences. I'll be speaking on the topic ACEs or adverse childhood experiences. Yes. Adverse childhood experiences are traumatic events that happen to a child during their formative age. ACEs can be anything from physical abuse and neglect to witnessing violence or growing up with someone who has a sustained abuse problem. Although ACEs can happen to any child, those from lower socio-economic backgrounds are more likely to experience multiple overlapping ACEs. All ACEs have extreme and long-term consequences. All ACEs have extreme and long-term consequences on a child's mental and physical well-being. Absolutely. No different. Whether you experience what kind of ACEs it is, there is a lasting trauma that affects you during your adulthood. The primary goal of this presentation is to bring awareness to ACEs among healthcare professionals and parents. A large number of healthcare providers and parents are not familiar with ACEs, and yet a growing body of research suggests that focusing on ACEs can make a significant difference in improving the life and health of those affected. My presentation will provide an overview of ACEs, the associated health risks, challenges, and potential solutions to ensure that the information presented is well rounded. I will begin by discussing the prevalence of ACEs. ec- The prevalence of ACEs. Yes, that's why I want to start with. According to CDC's adverse childhood experiences, at least at least 60% of adults in the United States have experienced one or more ACEs. Furthermore, the prevalence of multiple ACEs is especially high among those with lower educational and social economic background. This suggests that those living in poverty are more likely to experience much wider range of ACEs than their peers. For instance, those of us that are in Africa, can you imagine if people in the US are going through such? What about us? Think about it. So we're going to be talking about all of that. Next, I will discuss the potential health risks associated with ACEs, such as depression, anxiety, substance abuse, ch- substance abuse, and stuff like that. Children who experience ACEs may be more likely to engage in risky behaviors, such as alcohol and drug use, which can lead to further healthcare issues. Furthermore, ACEs can have a cascading A water foreign. ACEs can have a water foreign, a running over effects, leading to further health, health issues such as weakened immune systems, chronic physical health issues in adulthood. After that, I will share existing challenges and barriers to discuss, I mean, barriers to addressing the issues of ACEs, such as lack of public awareness, inadequate funding for mental health services, and the stigma associated with mental health disorder. I will also discuss how these challenges can be reconciled to ensure more effective interventions. I will introduce a variety of potential solutions ranging from ranging from uh, preventative, ranging from preventative intervention to addressing risk factors to direct clinical intervention targeting health outcomes. Furthermore, I will discuss both short-term and long-term solutions, providing clear examples of how they can be successfully implemented. Finally, I'll close my presentation with a call to action for healthcare professionals to not only become more aware of ACEs, but help to share tips about it and how to prevent ACEs. Adverse childhood experiences have been found to have significant effect on health and well-being in childhood, yet are still often not widely known or understood. This presentation will examine the importance of bringing awareness to ACEs among healthcare providers, parents, and other stakeholders, and the potential positives that can occur when ACEs are appropriately dealt with. Firstly, it is essential to define the term ACEs. What is ACEs? We all are talking about ACEs. What is ACEs? Which is adverse childhood experiences. What is it? So, ACEs are any traumatic experience a person has during childhood that can have lasting effects on their lives. These experiences can be physical, sexual, or emotional abuse, as well as growing up in a household with family members who have mental health issues, substance abuse problem, or incarceration that went to jail or that is in jail. Research has found that individuals with four or more ACEs were more were 2 to 4 times more likely to be diagnosed with serious illnesses such as depression, anxiety, substance abuse, or even chronic illnesses such as heart disease or cancer. Bringing awareness to ACEs is imperative in order to ensure that individuals do not suffer in silence and can receive appropriate support. Healthcare providers should be educated on the signs and symptoms of ACEs in order to diagnose these issues as early as possible, as well as be aware of the long-term risks that are that are or that are or that will. Yes, they need to know that. Mhm. If ACEs are not addressed properly, it becomes a very serious issue for our society. Furthermore, parents should be aware of the different ACEs that their children may have experienced, the potential impact that they can have. This will allow parents to seek appropriate help for their children and provide support in navigating mental health challenges. In addressing in addition to education, in addition to education, there are other strategies that can be used to address ACEs. What are those strategies? We say early prevention strategies are key for children who have experienced ACEs in order to reduce the long-term impact. How? This, this could include providing therapies, support groups, and educational resources to ensure that individuals have access to support that they need. Additionally, community-based programs that focuses on trauma-informed care, such as resilient education or parenting classes, can be used to equip individuals with the tools they need to be better equipped to address ACEs. It is of utmost importance that healthcare providers and parents become educated on ACEs in order to reduce their health burden and associated risks. The awareness surrounding ACEs need to be spread to ensure that individuals are well informed about the potential long-term impacts and effective strategies can be implemented to ensure that individuals get the support that they need. Of course, yes, yes. For those of you that are listening, my name is Raymond Falabomo. I'm always on the air today, which is Friday. It's not our usual thing we do. We went on the air is always on Monday, and we have foreign guests that come to our show as well as locals that come and present on different topics. But we started this topic and we didn't go in depth, so I just want to throw some spotlight on it that will enlightening our minds about what ACEs are and how we can uh, easily prevent it. That's why I'm on the show this morning to keep you awakening and keep your mind, set to the issue of ACEs and how we can prevent it. Of course, adverse childhood experiences are major traumatic events that can occur during childhood, typically before the age of 18. Examples of common ACEs include experiencing physical abuse, emotional abuse, neglect, witnessing family violence, substance abuse, mental health illness in the home or in the community, or having parents who are divorcing or separated. So, the prevalence of ACEs, I want to talk a little bit on the prevalence of ACEs, the facts, the facts of ACEs. The prevalence of ACEs concerning the well established research study from the Center for Disease Control and Prevention, CDC, found that two-thirds of adults surveyed have experienced at least one ACEs before the age 18. Moreover, the CDC also found that individuals who experience four or more ACEs were at a significant high risk for physical and mental health problems later in their lives. So let's talk a little more on the health risks. The health risks associated with ACEs are numerous. There are so many and can have profound impact on the individual mental and physical health. Research suggests that ACEs increase that increase the risks of potential physical health issues such as heart disease, diabetes, cancer, and or obesity, depression, anxiety disorder, suicide attempts, and substance abuse. Furthermore, individuals who have experienced multiple ACEs are at a increased risk yeah at an increased rate at an increased risk of chronic health issues such as diabetes, stroke, or cancer due to the long-term stress response that occurs in the body. So let's talk a little bit on the challenges and the barriers of ACEs. One of the major challenges, one of the major challenges in addressing ACEs is the issues. So one of the major challenges in addressing the issues of ACEs is the societal stigma and cultural norms that contribute to the problem. And other barriers to addressing ACEs is the difficulty in accessing services and resources. Finally, the lack of funding and public awareness has limited the ability of healthcare professionals and researchers to identify and treat individuals experiencing ACEs. So, what are the solutions? Let's talk about the potential solution. So, potential solution is the most effective way to address the incidence of ACEs is to build strength in the family. That's the easy way. How can we build the strength? By communicating. So we have to build strength in our family and promote safe and supportive environment for children and family. Increasing public awareness and education through public events, media campaigns, school-based programs is key to addressing the issues of ACEs. Additionally, working to improve access to services, increasing funding for researchers and treatment, and advocating for better policy and legislation relative, relative to ACEs can help to ensure that children and families get the support need. Conclusion. I want to conclude. And if you have any questions, this is Williams on the air. You can ask me. Um, you can send your comment. We have our comment box that is open. You can just send your comment to us and we will answer your questions. Whatever concern you have, send it. We are here to answer your question. Conclusion. ACEs are incredibly common, yet often unrecognized or underreported, and have been linked to a number of healthcare problems. Once more, my name is Raymond Falabomo. I'm the country director for Wings for Life International, which happens to be a non-for-profit organization that is in West Africa, Liberia. Thank you. So ask as many questions as you may want. I'm here to answer your question. If you have any concern as well, you can also share your thoughts on the issues of ACEs. Also share our video so that others can also watch our video and let us know what you think. Thank you. Yes. Thank you, and share our video.